Hi, I'm Dr. Mike Carragher. I'm Medical Director at the Body Well, and today I'm going to be showing you how to inject a medication that needs to be pre-mixed, okay? There's certain medications that will come in vials to you in powdered form. Those need to be reconstituted with bacteriostatic water and mixed up before they're injected. So I'm going to show you how to do that today. So as far as my supplies go, I have my medication here. It's in powder form. The size of this vial may vary depending upon the medication you're using, okay? You also will have a vial of bacteriostatic water, okay? This is the best type of solution to mix your medication with. Thirdly is an insulin syringe to mix and to inject the medication with. And then we have our alcohol swabs to make sure we're sanitary when we do the injections, okay? So the first thing you're gonna wanna do here is take your medication and just pop the cap off, just like that, okay? Same thing with bacteriostatic water, will come capped usually. We can uncap this. Bacteriostatic water can be reused, okay? And your medication, depending upon the type of medication you're taking, whether this is a single dose vial, so this is one that we will mix and inject the entire amount of medication in one shot. Certain ones will be what we call multi-dose vials, so you'll inject more than one dose worth of water in there to mix it up. So you'll use that medication for several injections. Just make sure you keep it refrigerated in between, okay? So in order to mix up the medication, typically we will uncap our insulin syringe on the needle tip end as well as the plunger end, okay? And then what we do is I'm gonna draw up however much bacteriostatic water your directions say to draw up, okay? In this case, got 0.7 cc's. Put the needle as straight as you can into the plunger. You want to be careful about this because insulin needles have very thin tips and they can bend easily, so you want to be careful to go at a 90-degree angle. Like to inject air in there just to create a little bit of a vacuum. And then you're just going to draw up like that. And I'm going to go up to the 70 mark here because that's what my instructions say. Okay, just like that. I'm going to pull that out. And what you're going to do is just put the needle tip at a 90-degree angle into the medication and inject the bacteriostatic water into the medication, okay? Once you do that, you want to gently mix the medication like that. You can roll it between your hands like that. One thing I don't want you to do is vigorously shake the vial because these molecules can be broken up if you do that. So we want to just gently invert the vial or roll it between your fingers like that. And you'll see after a few seconds, it's pretty much all mixed up like that. That's done already. Now, when it comes time for injecting, this is a small vial, and sometimes small vials worth of medications are a little tricky to get the medication out. So again, since we injected 0.7 into the vial, we're gonna draw 0.7 out. So I draw 0.7 of air back into the vial, inject that air into the vial to create a little bit of a vacuum. It makes drawing out this medication so much easier. You have to go a little bit slowly there. Don't worry about tiny air bubbles in there because this is a subcutaneous injection. The little air bubbles are not going to cause you any distress. So we've got all our medication drawn out of the vial. If you see any air bubbles, you can just tap it like that. Press the plunger up a tiny bit just so you see a little drop come out like that. And now you're ready to inject. Again, this is a subcutaneous medication. This can go in the belly, it can go in the arm, it can go in the thigh. It just really needs to go beneath the skin. Today we're going to do it in the arm. You want to clean this area with some alcohol first, just to keep the site of injection nice and clean. Let that alcohol dry for a few seconds so it doesn't burn when we inject. And then just like a dart, right underneath the skin, push the plunger down, inject your medication. Usually I like to count 5, 4, 3, 2, 1 after an injection, just so all the medication's absorbed. Pull the needle out, and that's it. So now that your injection's done, you're going to want to dispose of your needle. I don't recommend recapping needles because there's always a risk for stabbing yourself if you do that. But you're going to want to discard the needle in your sharps container, which either you've been provided with when you picked up the medication, or you can pick one up in a local pharmacy, okay? And that's it. For more information on hormonal optimization or age management or anything else that we do, please visit our website at thebodywellusa.com or call the office at 323-874-9355 and speak to one of our team members. Thanks.